Recently, several internationally prominent neurologists participated in an evidence-based review of the efficacy and safety of natural products for migraine at a national CME conference in Los Angeles, California. Part 1 looked at efficacy. This presentation is the safety of natural products for migraine, mechanism of action, and an audience Q&A. Dr. Hans-Christoph Diener leads off with a discussion of the tolerability and safety of natural products for the prophylaxis of headache.
Now, when I was invited to come here, I said, no, this is too far away, I won't come to Los Angeles. But then I got the flyer, it said free breakfast, so I said, I come. Now, what's the issue about tolerability and safety? This could be very short. I simply could say there is no issue. But why is it important? We run the biggest headache center in Europe, and we see about 4,000 new patients per year, and we follow them all. That's a requirement by the insurance company. So we need follow-up data at 6 months, 1 year, and 2 years. So we know exactly about compliance and adherence to what we prescribe from our patients. Now, from the about 3,000 migraine patients, half of them will get medical preventive therapy. And the 6 months follow-up shows that adherence to medical therapy with traditional drugs is 30%, 30. 20% terminate this because the treatment was effective and they don't need it anymore. But 50% terminate what we prescribe because of adverse events and side effects. That's reality. So half of the patients cannot tolerate the drugs that we prescribe. And this is why we need alternatives with good tolerability, in particular in patients where, let's say, it's not the most severe cases of migraine. This is slide number 1 from 3 slides on my conflict of interest, and this covers only headache. I could show you 5 more on stroke and a few on Parkinson's disease, epilepsy, and Alzheimer's. Now, how did I prepare this presentation? Up here, you always have the topic, what it is about, and I did again a Medline research on all of the studies I could find. I preferred randomized studies. I looked up information on tolerability, and I looked up information on safety. Now, ladies and gentlemen, there is a huge difference which you should not mix up. Tolerability are just adverse events, but this is safety, serious adverse events, death, hospitalization, permanent damage, and so on. But this is not really an issue when we talk about these kind of drugs. So let me start with riboflavin. You heard there is one trial in children, 48 children, mean age 11 years. It was a randomized trial, riboflavin 200 milligrams or placebo. Now, these are the adverse events that were prescribed. One child had new onset tension type headache on Verum, and one child developed diarrhea with placebo, and 4 children had a change in urine color. This is, by the way, a problem with this drug to blind trials because there are minor changes in urine color anyway, so we cannot blind trials with riboflavin. So no tolerability or safety issue with riboflavin. This is, in adults, a randomized trial you have seen from Jean Schönen, 400 milligrams once daily versus placebo, 55 patients. 1 patient developed diarrhea and 1 patient developed polyuria on riboflavin. 1 patient had recurrent abdominal cramps on placebo. Again, no tolerability or safety issue with riboflavin. If we come to the one randomized trial, placebo-controlled from Peter Sandor, 42 patients with migraine, Q10 3 times 100 milligrams per day versus placebo. 1 patient experienced cutaneous allergy on Verum. So again, no tolerability or safety issue with coenzyme 10. This is the pediatric and adolescent study, 100 children and adolescents aged 6 to 17 years, 100 milligrams Q10 versus placebo. It was a double-blind crossover, duration 24 days. And it simply states Q10 was well tolerated. There are no numbers on adverse events, but obviously there are no issues with tolerability or safety. Magnesium, there are 3 randomized studies. They are summarized in this review here. Magnesium doses between 300 and 600 milligrams. The only adverse event was diarrhea. Theoretically, with these high doses, there could be magnesium toxicity, which was not observed in any of these cases. Let me perhaps comment on the two trials that you saw from Richard Lipton. One was positive, one was negative. Both trials were done in Germany. Now, the positive trial was done in a GP setting, and the negative trial was done in a specialist setting. So there could have very well been a bias for more severe patients going into the second study, which was negative, and I would say the unselected normal migraine patients going to see a GP obviously had a response to magnesium. So this could perhaps explain the difference between the two trials. So the only side effect we see with magnesium, and if you increase the dose slowly, this is usually not an issue, is diarrhea. Now we come to Feverview. You know, this is an extract of Feverview given 3 times daily, 170 patients with migraine. I did this study. And here is a table from cephalalgia with all of the side effects. I just wanted to highlight the statistical values here. Simply whatever you looked at, these are also reported points. Frequency of adverse events, no difference whatsoever between Feverview. This is, by the way, the proper way how adverse events should be collected in clinical trials. This is why the table is so busy. But there was no difference, no safety issues with Feverview. There is also a systemic review. It identified 6 controlled trials. The numbers, patient numbers in the trials were between 17 and 170. The only AE reported were infrequent oral ulcers. Now let's come to Butterbur. There is a systemic literature search which was published in Headache in 2010. You heard there are 2 controlled trials. There are 187 patients. Doses used were between 100 and 150 milligrams, and the only adverse event was burping in 7 to 20%. Now there are 4 post-marketing studies in 188 patients. 7 complained of burping, 2 cases had a bad taste, and 1 case had a skin rash. So up to here, there were no really concerns about side effects. There is another trial, another review on 4 published randomized placebo-controlled trials, and again, the only reported adverse event was burping. Now there are post-marketing data available, and these identify 10 cases of possible reversible hepatitis. And I participated in this expert panel where all of these cases were reviewed by hepatologists. I was really amazed how much these guys know and how much they can identify out of liver biopsies, whether it's really toxic or not. And they went in great detail through all the 10 cases. In 9 of them, liver biopsies were available, and there was only 1 case where they clearly saw a relationship between the intake of Butterbur and a reversible hepatitis. So the incidence, if we look at all the prescribed or bought Butterbur, is about 1 case in 175,000 patients. So there is an extremely rare probability of reversible hepatitis. All of you are neurologists, and you know the incidence of hepatitis with anti-epileptic drugs. So this is a much, much smaller rate than you would see with valproic acid or you would see with topiramate or phenytoin or carbamazepine. So there is one important caveat. Not all available products pass the quality standards. You heard from Richard Lipton that you have to have a very sophisticated method to extract the compounds in the plant that cause liver toxicity. And therefore, it really matters whether a patient buys a drug or the natural product that is properly produced. And this is a caveat because some of these are available on the internet, and they will not fulfill the quality standards that are required. So, ladies and gentlemen, in summary, for the compounds that I reviewed, there are no major issues concerning adverse events or safety for natural products for migraine prevention. And I think in particular, patients who are afraid of adverse events, they had bad experience with drugs, and they asked me, can you recommend something where I will not have weight gain or tiredness or depression or whatsoever? I think we really should try these compounds, in particular if you look at the success rate, which is not too different from drugs like topiramate, valproic acid, beta blockers, and so on. Thank you very much.
As for the mechanism of action, Dr. Peter Goadsby discussed that while it is not definitively known just how these compounds work, research is elucidating some intriguing, plausible possibilities, and that, quote, just because our understanding is primitive about how things work is no reason to think that they don't. Richard Lipton has set out the very logical argument for their use when it's sensible. After the main session, there was time for a Q&A.
So the FDA does not provide quality control oversight for natural products. When a patient asks you, how do I decide what is a good product or what brand should I buy, what do you tell them?
Yes, so with respect to Butterbur, the answer is embarrassing a little bit in this context, but I tell them to buy the Lind Pharma Weber and Weber brand on the grounds that it's manufactured in Germany, the QC is good, and how the extraction is done really matters. And it's very difficult to know which other formulations have had the toxins removed and contain the appropriate active ingredients. So I actually, and that is the only branded recommendation I make. Now, I'm not saying that because they sponsored the symposium. They may have asked me to chair this symposium because I say that, I don't know. But I think for Butterbur it really matters. For B2 and MAG, I don't think it really matters very much.
So we should tell our patients to buy stuff made in Germany.
No, it's produced in Germany, it's sold in the United States.
So we were talking about adverse effects, not efficacy. The one thing I can say is that placebo rates tend to be lower in Europe than in North America across a wide variety of studies for reasons that I don't fully understand. The study I did was done at a couple of research sites where people were enthusiastic, and that enthusiasm raises expectations and may raise response rates both to placebo and active drug.
If you've not done so already, be sure to watch Part 1 on the efficacy of natural products for migraine.